Hi, Dr. Song here. Today, let's talk about botulinum toxin or Botox. Everybody kind of refers to all of these as Botox, but there's actually 6 different products that are FDA approved in the United States. So the confusion is, are they the same? Why do you choose one over the other? Which one is the best value? So let's try to decide that once and for all. And I'm going to base it on my experience. So I've been using all of these products and I've been able to compare them directly on the patients that I've used them on. So I've been doing this for like 15 years now. So I know that your results are going to depend on how we inject it, how much we inject it, and a little bit on what product. The product is really going to determine the value that you get. So let me explain. First, we had Botox, right? And all of them actually come in a powder. And if you look at a new vial of Botox, you're going to see nothing in there. It looks like it's empty, okay? Because the active ingredient is pretty much invisible. You might see a little white ring around the edge on the bottom of the vial, and that's the active botulinum toxin that's in the vial. In order to inject it, we can't inject it as is, we have to put water or saline solution in there, and people dilute it or reconstitute it differently. But for comparison, let's say we're using a 2 cc dilution or reconstitution for each of these, okay? And then let's compare. That's Botox. Dysport, if we look at a new vial of Dysport, you can actually see the white powder in there, okay? You can't really see much of it in Botox. And it says 300 units, and you can actually see the powder. So you would think that there's 3 times as much product in the Dysport as the Botox. Well, we'll see. And same thing with these other products. Let's look at the newest product, the Letybo. The white ring at the bottom is more visible. Okay, that's the active ingredient. So this one again is 100 unit. So I'd line these cups up to represent vials of the different products. Okay, so this is Botox, and these little packets of artificial sugar represent the number of botulinum toxin molecules that are in there. Okay, and of course it's not to scale, but just as a reference, and it's not exact, it's not to scale, so don't hold me up to this. This is my experience that I'm going to share with you. So let's see how much botulinum toxin is in a vial of Botox if we could actually count them.
1, 2, 3, 4, 5, 6.
Now let's see how many botulinum toxin molecules are in Dysport.
1, 2, 3, 4, 5, 6, 7, 8.
There are more botulinum toxin molecules in a vial of Dysport versus a vial of Botox. But look at the units. Are there 3 times as much molecules of botulinum toxin as in the Botox?
No.
No, there's a little bit more, but not 3 times as much. So if we put the same amount of saline in each one of these, which one is going to be stronger, would you say?
Dysport.
Yeah, because it's more concentrated, right? So now let's look at the other products.
1, 2, 3, 4, 5.
About the same as Botox. And actually in my experience, maybe a little bit less. Okay, let's go on to the next one, Jeuveau.
1, 2, 3, 4, 5.
Okay, similar in a 100 unit vial of Daxxify.
1, 2, 3, 4.
So how much was in Dysport?
8.
So we got about half the number of active ingredients in a vial of Daxxify. So we're gonna need 2 vials of these to make it about equivalent to the Dysport, right? Now let's look at the last one. This is the newest one, Letybo, that was just FDA approved.
1, 2, 3, 4, 5, 6.
I've just started using Letybo, so I'm not, very, very confident in this, but so far it seems like these are very similar, and I would say the Letybo is probably more equivalent to the Botox than the Jeuveau or Xeomin. But these, the units are the same, but the concentration, as we just saw, is slightly different, okay? But these can be kind of used interchangeably, unit per unit. Daxxify, 100 unit, is really equal to about 50 units of Botox, or about 150 units of Dysport. So you need 2 vials of that. Dysport, again, in my experience, has the most active ingredient in a vial out of all these products. So now let's talk about the price. So what we charge, or what your injector will charge you, is probably going to be reflecting what we're paying for the product. The most expensive product for us would be the Daxxify, okay? Because 100 unit is really a half a vial, and it just comes out to cost us much more per molecule of botulinum toxin that we're injecting. Botox is going to be the next most expensive. They were the first product that was FDA approved, and they're the most well known. So they can charge a premium and still get it, because this is the name that everyone recognizes. So if you're looking for the best value, these come in at lower price than the Botox per vial. So Jeuveau and Xeomin are the ones that are probably being sold at the med spas. Now Letybo, it's the new player, and this actually comes in at the lowest cost for us. So there's 2 things that can happen with the Letybo. Because of the lower cost to us, we can actually use this to play with the concentration, and we can make this the strongest botulinum toxin, or some people will use it as the least expensive botulinum toxin. So you're gonna find people trying to sell the Letybo at rock bottom prices, which is okay if that's what you're looking for. But if you're looking for customized treatment where we can actually change the dosage, the concentration, depending on the area, doing a full face, what I'm doing with this is I'm just offering this by the vial, so that you can use a whole vial on yourself and treat the whole face and still get it at a price that's comparable to doing your regular Botox or Dysport treatments. Now, let's do a demonstration. So now, let's simulate the reconstitution, okay? Let's say we have a vial of Botox with 100 units of Botox in there, and we're gonna take 2 cc's of saline solution, and we're gonna put it into the vial. So now, we have a 100 unit vial of Botox. And we're gonna put the same 2 cc's into the 300 units of Dysport. And then we're going to swirl it around. And now we have a 2 cc vial of Botox and 2 cc vial of Dysport. And we're gonna do the same for each of them. Letybo, Jeuveau. So now the Daxxify. remember, we said the Daxxify vial was about half the dose of botulinum toxin as the other ones. So to make it equivalent, instead of 2 cc's, I'm going to just put 1 cc in each, and I'm going to use 2 vials to make the same amount. These are 2 vials of Daxxify. If we had 1 vial of Botox, I typically use a 0.3 cc syringe. Now, obviously these are bigger, but this is a 3 cc syringe. So let's see how many of the 0.3 cc, how many syringes we can get out of a vial of Botox. Okay, so that's 1. We got enough to treat 2 patients with a syringe of Botox. So these all have the same volume. So we're going to get the same number of syringes out of each one of these. Except for this Daxxify, you need 2 vials to get the same amount. So now let's talk value. Okay? So we're going to be able to treat the same number of areas. Okay? But remember we said which one was the strongest? The Dysport was the strongest. So when I reconstitute these products, I reconstitute them all the same way with the 2 cc's of saline. And when I do that, the Dysport comes out to be the strongest. And because it's priced less than Botox, it also gives us the best value, because when I inject them with a syringe of Dysport, I get better longevity at the same price. Okay? So that's why I use Dysport over the other products. If price didn't matter, then I could use any of these interchangeably and get the exact same results. It only depends on how I reconstitute it, how concentrated I make it. So finally, let's talk about the newest product, the Letybo. So because they're coming in at the lowest price, doesn't necessarily mean that it's an inferior product if you know how to reconstitute it properly. So what can I do with this that I may not want to do with the other products? I can take a whole vial, and instead of putting 2 cc's in here, I could put 1 cc, and it'll be double concentrated. And guess what happens when we do that? It'll last longer. So we can customize it for people who want to have a product that lasts the longest. I can double concentrate it for you and adjust the dose specifically for what we're trying to achieve with you, because we're going to offer the Letybo by the vial. The other products, because you have more than you need, we kind of split the vial between patients. So we'll draw out the syringes, and use 1 vial might be used over multiple patients, which is an off-label way to do it, but most people are doing it that way. Otherwise, you'd be wasting the vial, and if you sold a whole vial of Botox to 1 patient, it's going to cost at least twice as much as the Letybo would. And remember, we said they're pretty much equivalent. So we're using the Letybo for customizing your doses, and we're using Dysport for the best value. That's how we do it at Omni Aesthetics right now, because we've tried all these and that's our experience. If you have any other questions, watch our other videos, come in for a consultation. We'd love to talk to you.